We brought in Dr. James Pinckney from Diamond Physicians. He is the CEO and founder. He's also from Chasing the Cure. And listen, Dr. James, welcome. And the only thing we are chasing right now is when the heck to wear a mask and which one to wear. Hello, good to see you.
Hey, good morning, Jenny.
Well, I hate that we can't be seeing each other in person and doing this in person. I know that you have been really, really cautious with regard to your practice and also your family. So I want to know about these N95 masks. In the beginning, we heard, hey, these are really just for medical professionals. Should any of us, should any regular people be wearing these? Who should be wearing these?
Yeah, N95 masks are really for healthcare providers. The 95 stands for 95% of the small particles are filtered so they don't enter the mask and can infect the person wearing the mask. Now, if you are taking care of someone at home that has COVID-19 and is tested positive, then yes, you could wear an N95 mask. But really at this point, these masks need to be reserved for healthcare providers, frontline workers that are coming in contact daily and constantly with COVID-19 positive patients.
If somebody has one, though, at home already, they happen to have one and they're not a medical professional, is it okay for them to wear it?
Yes, absolutely. If you have one already, wear the mask. You don't need to wear it when you're going out, if you're going to the grocery store or to do essential tasks. But if you have one, you can wear it. They're kind of hard to breathe in. The one that you have the picture of right there has a filter that allows air to be exhaled, so those are a little bit more breathable. But for instance, this one that I have right here in my hand doesn't have a filter. They can be very hot, humid, muggy, and challenging to wear for long periods of time. So I actually do not wear my N95 when I'm just going out to get groceries or fill up the car with gas. I wear a cloth mask in that instance that's more breathable. The point of the mask is really to protect everyone else from yourself. So in case I was an asymptomatic carrier and as I talk and laugh and even cough, those respiratory droplets are spewing into the atmosphere. And you really wear the mask to make sure that you're covering the face, the nose, the mouth, and those respiratory droplets don't go out into the atmosphere and can potentially infect someone.
Yeah, it's a sign of kindness and respect for your fellow human being, as I understand it. What about a surgical mask? When should people wear a surgical mask?
Yeah, so the three-ply surgical mask, I wore these a lot when I was a surgical resident. These masks, again, do the same thing as a cloth mask. We use these in the OR to make sure that we aren't, spilling respiratory droplets into the surgical field, and also if anything splashes up on us, it protects the face. But this is a great mask as well. It's a lot less expensive than an N95, so the audience can wear those masks when you're out in public. The whole point is to cover the nose and the mouth. It doesn't matter if it's a surgical mask or a cloth mask or a scarf. You want to make sure you're not spewing those respiratory droplets into the atmosphere that could potentially be infectious and infect other people. Now, social distancing recommendations are 6 feet apart. But Jenny, honestly, when we talk and laugh and cough, those droplets can go up to 15 feet. So I really want people to be at least 10 feet away from each other. And again, this mask does not give you an excuse to gather and get close together. We really need to be cautious. And this is the key to slowing down this pandemic. As you mentioned earlier in the show, hospitalization rates have doubled in North Texas. This is a serious issue, and we have to all do our part to protect each other and make sure that we're slowing down the progression of this pandemic.
Really quickly, we have about 10 seconds. Are masks with filters better? Is that offering a better protection for others or for ourselves?
Yeah, if you have a little filter pocket, that can filter more air. But again, these types of masks are not airtight around the face. So if you have a filter, great, but it's not going to be as sufficient as an N95. And again, the whole point is you are protecting everyone else when you wear a mask.
Dr. James, I appreciate you. I look forward to seeing you again in person sometime soon. But I'm always thankful for the real information. I hope everybody hears it. The message I heard was stay away from everybody, wear that mask to protect everybody else. Dr. James from Diamond Physicians, thank you again.